causing less availability nutrients to the disc, which promotes the degeneration and herniation. Bone alkaline phosphatase, the second marker, is a bone specific which reflects the metabolic activity and turnover of the osteoblasts. It hydrolyzes the phosphates and inorganic phosphates, and when it couples with the calcium, it will form the hydroxyapatite crystals. The deposition of calcium hydroxyapatite crystals again promotes the calcification. This was a case control study. We have taken the test group, patients confirmed for lumbar disc herniation with the MRI, and controls were the individuals without known previous history of back pain for the past 1 month period. We have taken 5 milliliters of venous blood from each category, and the separated serum was used for the bone alkaline phosphatase estimation and the serum calcium estimation. Statistical analysis was done by SPSS, and non-parametric test was used for the detection of significance. And both the test and control group we subdivided into females and males. Again, these two categories subdivided. Both disc is degenerated and herniated. The other category is only the herniation. In the results and discussion, when we see the gender distribution in the test group, almost equal females and males are presented in the test group, suggesting that there is no gender bias with this disease. And also when we see the number of disc degeneration and herniated patients, again there is a similar number of patients presenting in the female and male category in the age above 50 years and below 50 years. We also see in the distribution of degenerated patterns, most of them represent this group. So it could be associated with something regard to menopause and these things. We are doing some other parameters also, but for this study we haven't incorporated, madam.
Is there association between this and the levels of calcium?
Madam, the statistical analysis is going on for this study, madam.
Thank you.
How justified are you to draw this conclusion that BLP cannot be used somewhere down the line in your conclusion, cannot be used based on your study?
Actually, madam, all the bone alkaline phosphatase levels were within the normal reference range, although the male category above 50 years had a significant difference. Therefore, we think that it could not be used as a prognostic marker.
Did you calculate the sample size to estimate this?
Actually, the sample size was done by a statistician. They have taken some of the biochemical prevalence of biochemical parameters when calculating the sample size, madam.
You did not present that?
Sorry, madam?
Did you present it today? I didn't see you presenting your calculation of sample sizes.
I didn't put it, madam.
Cases and controls.
I didn't put it into this.
Because that's the basis for justifying any statement you make. The second is most of your presentation were in form of numbers.
Yeah.
It's very difficult to compare because basically in each group there will be different numbers. So
sorry, madam?
it's best to put percentages and the total in each category because you can't draw conclusions.
Yeah.
When you look at the graphic all along.
Thank you, madam.
Previous studies with age below and above 50 years in both sexes suggesting that degeneration does not associated with age as indicated in previous studies.
Because
that's a very broad statement because that we know this in the aging lot of degenerative process going on, but your argument that on degeneration does not associated with age.
Actually, sir, the previous studies are suggesting that it could be associated with age, the degeneration, but with regard to our one, there's no such thing we could observe. Actually, this was done in the Colombo district, but the people in a selected hospital, but the people were coming from the different areas of the population, but this was the first study conducted in Colombo.
Have you identified
I didn't get you, sir. Criteria, sir.
Thank you for an interesting